Hello everyone, my name is Alexis Akins, and today I'll be giving a persuasive speech on why nurses or doctors should be evaluated when dealing with elderly patients. 500,000 to 1 million cases of elderly abuse or neglect is recorded every year by the authorities. In today's world, many people do not see nurses or doctors as caring individuals who want to help the people in need anymore. Unfortunately, many elderly citizens are scared to go get help from the medical field because it is hateful behavior from the medical force. All nurses in the medical field are not neglecting patients, but a numerous amount of them are, and we must put a complete stop to this. So this evening, I'll be giving you a couple of reasons why nurses should be monitored or evaluated. Some nurses tend to lose their patience when dealing with patients, as well as nurses tend to neglect their elderly patients. Neglect of a patient is failure to properly attend to the needs of a care or a patient of care of a patient. Nurse misconduct when nurses provide substandard care or behave unethically or unprofessionally. Disgraceful behaviors such as the following are considered neglect and misconduct: ignoring the patient, physical or emotional abuse, failure to give medicine, keep records, or obtain informed consent. Stated in the Rebus Goldstein is nurses can get overwhelmed and frustrated, which can cause them to lose patience when dealing with a patient. Therefore, you can make aggression to a patient who is very unaware of the things that are going on or who cannot fight back in a certain situation. Causing physical harm to a patient is very unacceptable, such as yelling, calling names, belittling, or even just grabbing someone the wrong way. These actions can make patients very uncomfortable and not want to be in this facility anymore. For example, my mama, which is also known as my grandmother, she was in and out of Dyersburg Hospital for about 2 months. And while she was in the hospital, my grandma encountered misconduct a lot of times. For example, she had COVID for the first 2 weeks. So while she was in there, when someone has COVID, you have to put on this big old armor. So knowing she had COVID, she would press the button, and no one wanted to put on the whole suit to come in and help her. So they was telling people, if she pressed the button, ignore her, don't even worry about it. It was certain girls that would go in and help her, but only when they was on for their shift. They couldn't be there the whole time. So it was a lot of times my grandma was in there, and when you have COVID, you have a lot of bowel movements such as diarrhea. So sometimes she'll press the button, tell them she got to use the bathroom. No one would come, so she was forced to use it in her bed. So she was forced to use in her bed. She would press the button, try to get them to help her come clean. Nobody came and cleaned her up. So she was laying in her bowel movement for at least 4 to 5 hours, she told me, before anyone came and got her. And my grandma's skin is very sensitive, so that broke all the skin on her bottom away. Like nothing but raw meat. She asked them to come change her bed sheets. After that, multiple times, no one did. She needed to use the bathroom. Nobody helped her. She needed to move a certain way. She needed more oxygen. No one would help her. Nurses was, oh, we're not going to help her. And then it was new nurses, like people who haven't really been working a long time, and they was trying to use my grandma as a dummy to come test, get her blood, giving it in her neck and her arm. And most of the time she was on the ventilator when they was doing that. You're on the ventilator, you sleeping, you sedated. So it was just a lot of misconduct that was going on in the hospital. And we couldn't be there to help her because she was a COVID patient. So when she eventually got out, she called us. She was like, I'm ready to come home. This is very hard. I don't want to be here no more. They treating me wrongly. And I'm sorry, y'all. This is a very hard topic, but I'm going to keep going. In addition, she wouldn't have had as many bruises and broken skin if someone would have just came and helped her. Unacceptable behavior such as this happen in nursing homes as well, typically known as neglect. The most common type of abuse is delaying health care. In addition, failing to medicate the patient is also known as neglect. Elderly people do not like to be left alone or stuck in a room with no one to help them or no one to even talk to. They can't help themselves in some situations, so when they press or call the button for someone to come help them and no one comes, this is considered neglect. After being neglected within a nursing home or even a hospital, many elderly patients won't listen to anyone anymore. They decrease in progress, and sometimes they even die within due time. For example, my grandmother, I'm going to use her again. My grandma, she was in the hospital, and COVID left her to where she couldn't walk. My grandma had been in and out the hospital for about 4 or 5 months. So last time she went to the hospital in Memphis, they were a little bit better, but she said they were still neglecting her. And my grandma was diagnosed with heart failure and kidney failure. So when she got sent, I'm sorry y'all, this is an emotional topic. So when she got sent to the nursing home, she would ask them, y'all can't move, I can't get up and walk. Can someone come back here and sit with me? Or can someone come back here and help me change my clothes, give me a bath? No one wanted to help her. She would be like, I have to use the bathroom, I can't get up and walk. No one would come and help her. So again, she had to sit and use the bathroom on herself. She had to sit back there with no one back there to talk to, no one in her room beside, like she had nobody. She was just back there by herself. So a lot of times she felt like giving up. A lot of times she was very discouraged. She felt like she was a burden on a lot of people. So the time they finally came in there and they seen she had used the bathroom all over herself, now they decided they wanted to help her since she didn't use it. So when they go to pick her up, they drop her on the floor. And that was the straw for my granny. She was like, I can't do this no more. They neglected me here. I want to come home. I want to come home. So when she decided to come home, they decided not to give her medicine anymore. Not even the dosage that she needed for that day, which the insurance told her that they were supposed to give her the dosage she needed for that day. So shortly, 2 weeks after she came home, she was here. And we had a hospital bed and everything here. She passed away with heart failure because she didn't have that medicine. Whew. But, you know, neglect is a very serious topic, and we must put an end to this. If she could have been treated differently, she wouldn't have felt like she was a burden on much people. So if we could have nurses evaluated while taking care of patients, hopefully no other elderly people have to go through the same thing my grandmother went through, have to go through the same pain and feel like they aren't good enough, they're a burden on people, or just feel like they want to give up. The result of neglect and abuse has caused the rate of accidents, mistakes, and deaths within the hospital to increase. Patient safety states in high-income country, it is estimated that 1 in every 10 patients is harmed while receiving hospital care. It is said that 98,000 people die a year from mistakes made by the medical field. In conclusion, misconduct and neglect of innocent patients is something we must put a stop to. I wanted to make you aware of the danger from nurses. My goal in this speech is to help spread the word about the disgraceful behavior so evaluation and monitoring can take place within the medical field. I hope after my speech you can help me spread the word about how important it is for nurses and doctors to be evaluated to help take better care of people within the medical field, people that's in the hospital, nursing homes, home help, anything. We must put a stop to this because people are dying from it, seriously getting hurt, and their mental is getting seriously destroyed. Thank you.